Assalamu alaikum. The long clinical consultation day. First scenario, Mr. Ali. He is 45 years old. Please, with complaint of joint pain. Please take history and examine the patient. Yes, you can start now, Dr. Sally.
Hello, Dr. Abdel. You are Mr. Ali, who is 45 years old.
Yes, doctor.
It is okay to discuss with you about your condition and to examine you.
Yes.
It comes to my knowledge that you have a joint pain. Can you tell me more about?
Yes, doctor. I have been having this joint pain for last 6 weeks, and it's all over my body. They are aching all the time. So I don't know that how I'll get relieved.
Sorry for your complaint, Mr. Ali. You said to me for how long?
6 weeks.
Do you have a complaint like this before or this first time?
No, doctor. I don't have this kind of a pain before.
Sorry for your complaint. You said to me that it's all in your joints, not a specific side. Is it?
Yes, doctor.
Okay. So, can I know if you have any swelling?
No, doctor.
Okay. This joint pain, it increase with movement if you move or walk or you do any activity.
Doctor, I have pain, but it's all the time. Most of the time, with activity, with rest. It's all the time.
So, any high body temperature?
No, doctor.
Any tiredness or fatigue?
Yes, doctor, I feel tired too.
For how long you are tired?
The similar period of time.
Okay, so this tiredness all the day or the specific time you feel more tired?
Doctor, all the time.
All the day. Did you seek medical advice for this complaint?
No, doctor.
Okay, so this tiredness, any dropping of your eyelid or any other associated symptoms?
No, doctor.
Okay, any lump or bump?
No, doctor.
Any change in your water function?
No, doctor.
Any skin rash?
Yes, doctor, I had eye skin rash. It was 6 weeks back, but now it's gone. I had a rash. It was a painless rash in my skin, but now I don't have it.
So if I ask you about that, can you remember more about this rash?
Doctor, it was a kind of some redness in my legs, and it was not painful, but it remained for a few days, then it's gone.
Is it in any specific sites in your body or all your body?
No, it was on my leg only.
Okay. So in the front of your leg or in the back of your leg?
Doctor, it was most of the time front of my legs.
Okay. So is there any blood or secretion from that leg?
No, doctor, no.
It can be ruptured sometimes like that with leak of fluid.
No, doctor, it was just a non-painful rash, light pinky in color, and that's it, nothing else.
Any scale, I mean by it looks like dry or some shiny in that rash?
I don't remember, doctor.
Um, is it dry rash?
Yes, it was.
Okay.
Not now.
Is it itchy? You feel you want to it?
Yeah, At that time it was itchy, doctor, but it gone. It lasted for only 3 to 5 days, and it gone.
Any attacks like this before long time,
No,
years or
doctor,
more?
never. No.
Any family history of similar complaints, similar rash?
No, doctor, my mother has diabetes, nothing else.
Your mother diabetes, is it came to her at which age?
Doctor, when she was 50 years old.
So, do you have any back pain?
Doctor, I have pain in my whole body, not specifically in the back.
So, can I know an eye problem, an eye complaint?
No, doctor.
It's okay. So, um, any frothy water?
No, doctor.
Can I know your medication list?
Doctor, I'm not taking any medications.
Any allergy for any medication if you took in the previous?
I don't know, doctor.
Medication you took before and you stopped?
Doctor, 6 weeks back, I had an illness. I had some cough, and for that, I take some medications, some syrups, and some medication. But it was almost 6 to 8 weeks back. Other than no medications.
You know that name of medication?
No, doctor, I don't remember the name the JP gave me.
So any medical illness, shall I know?
Sorry?
Any medical illness, any past illness you have?
No illnesses, doctor.
So apart from diabetes in your family, no similar rash or any other problem, joint pain like
No,
that.
doctor. No, doctor.
It's okay. So can I know if you what is your job?
Doctor, I'm a taxi driver.
How this affect your work?
Doctor, it's been like few weeks. I've been tired. I have this joint pain, and like it has affected my work life and my daily life as well. I don't feel good. I have a very low mood as well. I don't feel good.
Sorry for your complaint. You feel that you can't drive? Is it effective, or you feel tenderness while you are driving?
No, doctor. I didn't feel any tenderness. It was just pain, but I didn't feel any tenderness or hotness or nothing like that.
Did you smoke?
Yes, I smoke.
How many per day?
I smoke 20 cigarettes per day.
I advise you to stop smoking, and if you need help, I will refer you to smoking cessation clinic. Is this okay with you?
Okay, doctor. Thank you.
Did you drink alcohol? Consume alcohol?
Mm, no, doctor.
So
Mom, why are you setting a timer?
No.
so
Sorry.
regard you are taxi driver, you say to me, and you feel tiredness for these 6 weeks. Is this affect in your income? Do you have a family or
Yes,
supporting?
doctor. Yeah. I have a wife and I have 2 kids. I have support. I have support available, but it's affecting overall.
Okay. So what about your gait? You're walking. Any change in your gait?
Sorry. What?
Gait.
At my workplace, you mean?
You walk in your gait.
Gate? No, nothing. It's the same. It's the same.
So any shortness of breath?
No, doctor.
Any cough?
I have some cough, doctor.
For how long?
Doctor, it's for a long time. It's been for like 1 year. I have been coughing. I am a smoker, so I cough most of the time. It's nothing new.
Is this cough increase with time?
No, doctor, I have been coughing. Uh,
Is your cough dry or productive?
Doctor, it's dry most of the time.
Did you seek medical advice for this cough for this 1 year or more?
Yes, doctor, I've been advised to like quit smoking and wear masks, but I can't quit smoke, so I continued.
So you mean that they do investigation and they confirm that it is related to the cough, to the smoking,
Okay.
is it? Okay. So any abnormal, sorry,
Okay, please.
do you want to say anything?
No, I didn't get any test or any test for that. It was just an advice.
Okay. So any abnormal heart racing?
No, doctor.
Okay. Any leg swelling?
No, doctor.
Any loin pain?
Doctor, I have some tummy discomfort.
Sorry?
I have some tummy discomfort.
Sorry for your complaint. For how long is this tummy pain, this tummy discomfort?
Doctor, for you can say 2 months.
Okay. Did you seek medical advice for this complaint before?
No, doctor.
Where exactly this tummy pain?
Doctor, it's mild. It's all over.
Okay. So any change in your bowel motion?
Yes, doctor, I feel that my bowel are tight.
Okay. Sorry, can you repeat?
Tight, hard. I feel
Difficult.
they are tight.
Anything you use it can improve this. You mean difficult to pass?
Yeah, yes, I have hard stool, so sometimes I take some syrups to like some syrups for that. Yes, I do take it.
For your complaint. So
Yes,
yes. So can I know your diet type? You eat vegetables like that?
doctor, my diet and appetite has been reduced for 2 months. I'm not eating much. I don't feel like eating.
It's okay. So any change in your weight?
Yes, doctor, I feel that I have lost weight.
Sorry for your complaint. That any feeling of um, uh, change in the physical activity?
Doctor, physical activity, I have the strength to do daily activities, but there is some mild tiredness is there as I mentioned you, but I can do my work. I'm tired. I'm tired, but I can do my work.
Sorry for your complaint. So
Mm.
did you travel recently?
Sorry?
Did you travel recently? Traveling.
No, doctor. No traveling. No traveling history.
Can you tell me about your mood?
Doctor, I told you my mood is low. I don't know. I feel low because of my tiredness and these joint pain. I feel low.
It is okay to arrange with you for doctor mood doctor to support you some.
2 minutes
Mhm.
left, Dr. Sally. I will add 2 minutes after the time will finish, just to address the concern. So you can start examination now.
So I will examine you.
Okay.
I want to start with that joint pain.
Mhm.
I will see which part of pain of in your body. I will look for any swelling. I will try to palpate for and look to the
Mm.
patient for any sickness. I will
Negative.
okay. So I will check for the tummy pain for the abdominal pain. I will do superficial palpation for the any tenderness. I
Negative.
will
No tenderness right now.
examine the chest for the cough. Um, uh, any crepes or wheezing.
Okay. You can hear some fine crackles in the right upper zone of the chest.
Okay. So any basic crackles,
No.
any murmur in the heart.
No.
Can I know what is your concern, please?
So, doctor, what is happening?
This is a type of illness called psoriatic arthropathy. This is a medical term. It's related to that rash which happened before. This due to the defense of your of your body, despite of protect you, it defends you that joint. So you feel that joint pain and that skin rash and that general fatigue and tiredness and loss of appetite, all as are related with one problem. But I want to do some investigation to confirm my suspicion. Is okay with you?
Okay, doctor, will you admit me?
Sorry?
Will you admit me? Admit me in the hospital? Will you?
Yes, I will admit you to do full investigation to know what exactly the cause. Do you have any other concern?
No, doctor.
It's okay. So I want to examine, check for blood pressure and vital sign for the temperature, if available temperature chart.
Patient is afebrile.
It's okay. Blood pressure.
Blood pressure 120 over 80.
I want to do eye examination, general, for pallor and jaundice. Or any sign of
Yeah.
inflammation.
Okay. No sign.
I want to look to the back for possibility of hidden rash, another rash or back pain. It's okay.
Negative.
Okay. So
If you're done, you can thank the patient. Thank the patient and go to the examiner, okay?
thank you.
Okay, the examiner question. Dr. Minam, you can start.
Okay, sir. So, from the positives in the case, what are your differential, please?
45 years old male complain of joint pain, loss of appetite, weight loss, and skin rash, and cough. Um, um, he has a family history of type 2 diabetes. Clinically, he has normal vital sign with upper zone crepitation. There is generalized joint pain with no swelling, no appearance of skin rash, no leg swelling. I check for eye for any inflammation or pallor or jaundice. Negative sign. It's okay.
What are your differential?
I'm thinking about psoriatic arthropathy.
Okay.
I'm thinking also in reactive arthritis, but I didn't found support symptoms or sign. Maybe also that complaint of the chronic cough. I try to relate the reactive arthritis as a cough related tissue, but it was apical symptoms in the lung, not all effect from the smoking. So
okay. So how will you investigate and manage this patient?
I will start with routine investigation, complete count, renal function test, liver function test, electrolytes. I will do skin, but the rash now is not clear. So I will do X-ray for chest X-ray and joint X-ray. Um, um, I will do lung function test to know which type of his illness.
Okay.
Okay.
How will you manage?
I will give him first painkiller. Then I will admit him. I will give him painkiller. He need workup, so this is my issue for admission. Don't know what exactly the cause. He has general malaise. I will start with non-pharmacological management about patient education, counseling, social support. He is now financially supported, but maybe after investigation, he needs some support. Rheumatology referral, chest physician consultation. Then I after confirm of my differential, according to the finding, I will put my management.
Okay.
You're done, Dr. Mina?
Yes, sir.
Since we have 30 seconds remains, so I will ask her one question. Dr.
Yes,
Sally, why you want to admit this patient? Based on what?
My differential is psoriatic arthropathy, no need for admission.
Yes, so up to this moment, this patient with this criteria, I don't think he need admission. You can arrange appointment, right? Okay. What's the criteria you can decide to admit this patient on it? What will happen or what you can find in the history can let you admit this patient? What do you think? Based on the differential you give, anything can let you admit the patient, change your decision?
I think no strong indication for admission.
Okay. Let's talk about the joint pain itself. What is the single indication to admit a patient with joint pain?
It is swollen and hot, so I will suspect about septic.
Perfect. Yes, good answer. Okay, so septic arthritis might be the only indication to admit a patient with joint pain. Otherwise, some patients need to be followed or reassessed or evaluated before admitting him. But for septic arthritis, it's the only indication or the clear indication, not only. Maybe there is another, like hemophilia with the hemoarthrosis, right? Hemoarthrosis is also one of the indication to admit a patient with joint pain. Some mechanical pain with affection to the neurological, like back pain with affection to the neurological manifestation or weakness or whatever. But the most important in this scenario, as a peripheral joint, septic arthritis could be the reason to admit a patient. Otherwise, no need to admit this patient right now. Okay, Dr. Sally? Okay, let's talk. I'm done with the question. Dr. Minam will comment, then I will comment, okay?
Okay.
Yes, Dr. Minam, please, you can comment now.
So, sir, this is a case of differential diagnosis for hypercalcemia. This is a case of squamous cell carcinoma leading to hypercalcemia. Second differential is sarcoidosis, and third could be like primary hyperparathyroidism, or it can be any. So this was the case.
Okay, this is regarding the case. Regarding the performance, you can comment?
Yes, it was nice.
Okay, what do you think she missed? What do you think in the history she need to be stressed on? What she missed in the examination? You can tell her. I have some
Okay.
comment also, but please, you can comment also. It's
Okay,
complementary.
so yes, sir. So, sir, I would like to comment that for the joint pain, few more questions can be added to help her, like how it gets better with rest or activity. What type of a pain is it? Is it with stiffness? And any more questions that for aggravation, progression, and other than that, there was some weight loss. How much, and was it intentional or unintentional? And the appetite was reduced in the patient as well. So there were constitutional symptoms. Plus, if I talk about hypercalcemia in this case, so sir, there are a few questions if we start from the head. That if a patient is having hypercalcemia, if we start from head, there could be headaches, there could be depression, low moods, and there could be joint pain in whole body. Arthralgia can be a presentation with that, and there can be dryness in the mouth, can be one of the possibilities as well. There can be in the bowel, I mentioned about some tight or hard stools, tummy aches will be there. There could be gravel sometimes in the waterworks, sometimes not. There can be any presentation of muscle aches as well, and this could be there. And for sarcoidosis, there was a hint of some cough or some rash a few weeks back. So there was this rash on the leg which was not there. So it was just a hint to help. And with that, many associations are here for any eye soreness or any rash or recent illnesses of cough. And the apical pine crackles was there, which could be related with the cancer itself, or it could be a post sarcoidosis fibrosis, could be one of the possibilities as well. And other than that, um, drug history can be, she asked the drug history. She asked the drug history very well. And that's it, sir.
Okay, thank you, Dr. Mina. Well done. A nice case as a differential. However, now I will comment, or I will ask Dr. Sally, what do you think, Dr. Sally, about the analysis? So we will analyze it part by part. The first thing, the joint pain. What you miss in the joint pain analysis, Dr. Sally? Dr. Sally, you can unmute yourself, please. What you miss in the joint pain analysis?
I miss in the stiffness, but regard the rest and is it inflammatory or mechanical? I have asked about the
Yes, I
activity.
agree. You ask. Yes, you ask. But if you think the surrogate is trying to distract you, ask him another question. So if you ask him what you think increase the pain, and he just give you a deviated answer, you can ask him what can help this pain to move or to subside. Okay, or you can specify the question. Do you think the movement make the pain worse, or the movement will make the pain better? So you have to know, is it mechanical or inflammatory? Based on this answer, you will know this case and you will narrow your differential. If you don't ask and you didn't get a clear answer, you will be confused all over the scenario. Clear?
Right.
Okay. The next question, what do you think about the pain scale? Is it important? Pain
Yes, sure.
scale. Did you ask?
Sure. No.
Okay, what the importance of the pain scale?
Um, it I think the chronic illness or the mechanical, it gives the more severe pain, but it is if it is inflammatory cause, or it will be in the mid, maybe 5 or
Okay, so the two important indication or significance of asking this question is to offer painkiller, particularly if you have pain scale more than 5. So I will offer painkiller. Plus, I can admit or I can decide to admit this patient for.
Okay.
because it will consider as severe pain. Clear? So
Yes.
this is regarding the analysis of the complaint. From the analysis of the joint pain, you have to know either mechanical or inflammatory. Otherwise, you'll be confused all the scenario. Okay, back to the relevant system. What do you think the relevant system in this scenario? Musculoskeletal, right? So you have to ask about any other joint affection, any stiffness, any skin rash, any muscle pain, any bone pain. This is the
Yes.
relevant system, right? Okay, we will finish this and we will move to the constitutional. The problem is you are asking some questions, then skipping the others. So the constitutional here, you got the patient is losing weight at the end, which make you more confused. So if you ask this question earlier, as approach, you have to start with the constitutional. This is what I prefer to do. So the constitutional symptoms, if you have positive constitutional symptoms, loss of weight, loss of appetite, what do you think the case will be?
Yes. If it is from the first, yeah, it can lead me to uh, more chronic illness with weight loss and
Perfect. So you put in your differential the cancer or the connective tissue disease, right?
right.
Okay, so we got one differential from this system, which is the constitutional symptoms. The next system will ask, of course, you have to ask night sweat, the fever, loss of weight, loss of appetite, lumps or bumps. Even anyone told you are paler, the tiredness, all these question, one of the question of the constitutional symptoms. The next will be the past medical history. Okay, past medical history, not only medical condition, even surgery, allergy, medication, as you ask, procedure, admission, hospital admission. Okay. So you have to ask this, and it will help you in some cases. For
Okay.
example, last week we had a case of post-streptococcal or post-medication interstitial nephritis. If I will not ask about, do you have any history of hospital admission or illness I should be aware of, you will not know the case is related to the medication patient received. Clear?
Yes.
Clear. Okay. Sorry, I will mute. The next question or the next thing to do is the system review from up downward, from the head till the toe. CNS wise, headache here will be important because this patient is having. Do you think this patient will have headache? I think no headache, but he has mood change, right? The mood change is related to what?
Hypercalcemia.
Hypercalcemia, exactly. Okay. So the CNS, I should ask about pins and needles, headache, blurring of vision, redness in the eyes. In this scenario, could be one of the positive finding, right? As sarcoidosis can lead to uveitis, right? Let's go further. That next system, get in this endocrine. So you'll ask about the endocrine in the form of intolerance to any weather. Then you will go to the next system, the chest or cardiovascular. Any chest pain, awareness of heartbeat. Here it will not be positive, for example. Then the chest. Yes, I have some short of breath along with cough. What the type of cough? Here will be short and dry cough. So it's affecting, or you will think about fibrosis. Here, very important question you have to ask related to the cough. What do you think? You didn't ask, and I think Dr. Minam didn't say. If the patient is having cough and you suspect cancer, what type of cough you have to ask specifically? Dr. Sally.
Yes, I hear you. I'm thinking.
Yeah. Patient losing weight, smoker, no
Right.
appetite. What type of cough you should have here, or you might have?
Dry cough for a
Dry
long
cough
time.
always will be with the fibrosis. But if this patient suspected as a cancer, what do you think the cough will be here? It could be
Productive
bloody.
with blood.
Bloody. Yes. So you have to ask, do you have any cough? Coughing up blood. Once you have coughing up blood, the diagnosis will be very, or the differential will be very narrow to the cancer or TB, or, for example, or pulmonary embolism. Okay. In this scenario, you might have cough of blood. So you have to ask about any coughing of blood. Next system, the GI. Any difficulty of swallowing, any tummy discomfort, any tummy pain, any change of verbal habit. Here was constipation. So now I am confirming more and more. I have hypercalcemia symptoms. Then any back pain or tummy pain in at the back, or any passing stone. It's very important. I'm loin pain. You ask loin pain, right? So it's
Yes.
related to the water work, which is very or increased in the amount and the frequency. Polyuria related to hypercalcemia. Any passing gravels or passing stone. And to confirm it more, ask about thirsty. Do you feel like you are thirsty than before? Yes, doctor. I'm drinking more water. Again, this is all the symptoms of polyuria going with the hypercalcemia, right? Sorry. The next system, musculoskeletal, which already analyzed earlier. So I am done with the systemic review. Now I will go to the family history. Any family history? If not, yes, my mother is diabetic. No need to ask about what age. What do you think the importance of the history of family history here? For example, if you suspect this is a sarcoidosis, sarcoidosis is one of the inherited condition. It's not. Most of the autoimmune, yes, it runs in family, but not as genetic one. So I will ask any family history of joint, of cancer, just to have a clue if I have, for example, some genetic condition. But the diabetes in the mother, how is she now? She's fine. That's it. Forget about it. Don't ask about the history of diabetes in the mother. It's not necessary here, and it will waste some time. Next, the family history, travel history. I can ask because I suspect here cancer. And female history, including the partner, the casual relationships, any recreational drugs, any sharing needles, and tattooing, piercing, whatever. Do you smoke? Yes. How much? For how long? Do you drink alcohol? How much? For how long? Do you exceed the limit? And if any smoking history positive, you suspect a cancer, you have to stop smoking. Not only, even in any disease, you have to stop smoking, particularly in this scenario because it's directly related. Do you, what's your job? How is the impact, or what the impact of your disease or your symptom on your job? No need to ask about the income at all. Whatever he's working, even if he's not working now, I want to ask about what support he need. I will not ask him, how is your income? I want to ask him if he's supported at home. That's it. Some patients, if they are well supported and sitting at home without, I mean, with no income, but they have the whole support, particularly in UK, most of them are supported well, even without job, right? So the most important here related to his concern, I will ask about his support at home, how you are dealing with this at your home, with daily activity, with your job. If he's not working, I will ask about daily activity. That's it. If I need to support, I will refer him for further support as needed. But don't ask financially particular. Don't ask about the financial support or how's your income now. You can ask about his impact on the job, but I will not ask how is the income. Okay, let's skip to the examination. I want to examine you. The hand, a lot of things you have to examine. You didn't do. It's not only a matter of joint pain. Even the nail change. You suspected psoriatic, right? Psoriatic arthritis. Did you examine the nail for nail change of psoriasis? So I have to examine the nail, the joint, look, feel, and move. Some in the palm, like pallor, leukonychia, quilonychia, you can ask these things if you suspect something might be related. Here, anemia can be, so I can ask about pallor. Then I will go to the eye as you did. Any redness, or pallor or jaundice. And the vital, of course, you have to ask before examining the patient. I want to know the vital chart of the patient. Give me the vital chart, 1, 2, 3. If you want to examine or offer both hypotension, offer it. Otherwise, start examination of the patient. How the general look and hand examination, as I mentioned earlier. Then you will go to the chest. Here you have to examine the chest like full examination, because one of the system affected here is the respiratory. So I will do inspection, palpation, percussion, auscultation. If I don't have time, I will do at least the auscultation. Clear? So I will have apical and crackles, respiratory crackles. I will ask him to cough, and that's it. Then the lymph node is very important in this scenario. So the hand examination or the joint examination, the chest examination, the lymph node examination. I have some skin rash. Show me it earlier, and during the examination, I will see it again. So I will examine the rash, and I will ask the concern. Okay. If you follow these steps, you will not miss the case. Okay, Dr. Sally. Maybe the system review was up and down a little bit with you, but inshallah, next time you will be better than this.
Inshallah.
Okay. So differential diagnosis wise, you have to know what the case about. Is it mechanical or inflammatory? And accordingly, you will put good differential. You have any question? Dr.
No,
Sally?
it's okay.
Okay.
It's okay.
Yeah, Dr. Minam, you have any question or you want to suggest anything?
No, sir. Thank you.
Yes, okay. Dr. Sally, you can post your scenario for Dr. Minam. Then I will read some of the concerns, some of the comments here. Should we examine the abdomen? If you have time, or you can say, I would like to examine the abdomen. What do you think the abdomen here as a positive finding? Yes, there is abdominal pain or discomfort, but I don't think you will have anything related to sarcoidosis. In this scenario, will give you positive finding in the examination. Even hard stool or constipation, it will not give you anything. So if you have time, you can offer. But I don't think with the systems I mentioned, you will have time to examine the abdomen. But don't tell me I will examine the abdomen and I will miss the chest. Okay, this is against the all examination. But if you finish the system I mentioned, you have to offer the others, or if you have time, you can do it. Otherwise, no need. Lymph node here is very important. Don't miss the lymph node. You are suspecting cancer. Clear? By the way, every case, you might have 3 systems at least to examine. Here it was joint. So I will examine the joint, look, feel, move. Lung affection. I will examine the lung and the skin rash. Plus the lymph node, of course. Lymph node, chest, skin rash in this order, because you are starting from the hand, then the head, then the lymph node, the neck, the chest, sorry, and finally the leg or the skin rash. The complaint of the patient joint, so I said you have to examine the joint. The joint is, the complaint is joint pain. Dr. Minam, your scenario, Mr. Barian, 53 years old with complaint of abdominal swelling. I will go back to the comments. Yes, Dr. Ayula, as usual, and Dr. Henry, the differential. See the differential, how much and how wide it is. But with the history, you will narrow more and more. This differential enclosing rheumatoid, gout, pseudogout, reactive, multiple myeloma, hemochromatosis, trauma, SLE, sarcoidosis. Okay, whenever you will go more, you will remove one of the differential or 2 or 3, and at the end you will narrow more till you have 3 differential. By the way, sometimes you can remove the whole list and you put 3 new. Why? Because the scenario will go different. As in this scenario, I didn't think anyone put sarcoidosis. No, good. Dr. Ayula put sarcoidosis. Perfect, Dr. Ayula. But she put it number 6, 7. Okay, so please always put the differential for the commonest, and accordingly you can remove from your list. Dr. Zoom, or ankylosing, reactive, psoriatic, arthritis, rheumatoid arthritis. Okay, I will give you good advice. Better than mentioning every disease by name in the differential, and you will waste time. Okay, of course, I agree with this in our list or in the in the chat box. In the exam, don't write all these things. Why? It will waste your time. So what I should write, doctor? You will write the tip or the headlines of your differential. For example, I suspect mechanical, so I will write the mechanical joint pain, and I know by heart what are the mechanical joint pain. The second differential, I will put inflammatory, and I know by heart what are the inflammatory. Last one, which is alone, and I should put it alone. Why? Because it's the most serious. I have to remove it or I have to confirm it, whatever the case, which is septic arthritis. I will put it alone. Why? I should ask a question related to the septic arthritis and I should roll it out while taking history. If no redness, no swollen, no hotness, so I can remove the septic arthritis from the list. Here we are talking about inflammatory, so I cannot say this is septic arthritis because nothing going with the septic arthritis. But I will conclude this case or this scenario is about inflammatory joint pain. What I know about inflammatory, either seropositive or seronegative, right? Seropositive, I know them. Rheumatoid arthritis and the SLE and the mixed connective tissue and all the seropositive. If not, systemic sclerosis and so on. If seronegative, I will write other ankylosing. I know them by heart. So ankylosing, reactive, psoriatic, sarcoidosis, as in our scenario today, Behcet, okay, and reactive. I mentioned already reactive or enteropathic related. That's it. But please don't finish the analysis of the joint pain without knowing are you having mechanical or inflammatory. You will be confused and you will be distracted all the scenario. Okay, let's go to the next comment. Dr. Nada, if joint pain or skin rash, show me. I agree 100%. But she said the rash was before. Anyway, you can ask whatever or whenever the patient is saying, I have a rash, please show me. You will narrow your differential more and more and more. In sarcoidosis, what do you think the rash here, Dr. Sally? We didn't ask you this question. What are the... Yes?
Erythema nodosum.
Perfect. Okay.
But I didn't know that erythema nodosum will disappear. So
It's okay, but you have to mention it. It could be the associated skin rash with the sarcoidosis, okay? Okay, back to the comment. Dr. Ahmed, need analysis of the nature of the pain. Show any part. Yes, eye pain, redness, disturbance, septic arthritis, renal colic. Yes, flare of the disease with itch, with history of a skin rash. Doing with NEN and erythema nodosum. Yes, I think there should put sarcoidosis first, then squamous cell lung cancer. Okay, Dr. Nada, I agree, but please, once you have something alarming and serious differential, you can put it in the top. I'm suspecting cancer, right? Particularly this patient is smoker. I cannot say no, I have to confirm the sarcoidosis first. I should remove or I should rule it out first as a cancer. Then I will say the second differential will be sarcoidosis. I agree with the coexisting erythema nodosum. Now the top differential will be sarcoidosis. But please don't put the cancer at the end or at the bottom of your list. Don't tell the patient, no, unlikely to be a cancer. Okay? Once the patient is smoker, heavy smoker, he has bloody cough, for example, I cannot say or I can't tell the patient or reassure him that this is not a cancer. Okay? bloody, no familial hypercalcemia. Yeah, the only familial hypercalcemia, it's not hypercalcemia, it's hypocalcemia. Okay, there is a condition called, what the condition will be having hypocalcemia? Familial hypocalcemic,
No from me.
sorry? What is the condition which is familial? It's called familial, as familial. Anyone knows? Okay, apart from pseudo hypothyroidism, this is a condition which is familiar, right? Autosomal dominant, Albright syndrome. One more condition, you will have hypocalcemia. Familial hypercalciuric hypocalcemia, right? Anyone wrote it? Yes, perfect. Dr. Zoom. Yeah, familial hypocalcemic hypercalciuria, or the opposite, hypercalciuria, hypocalcemia. Okay, this is a familial condition with hypocalcemia, but we are talking about hypercalcemia, not hypocalcemia. Sarcoidosis is one of the differential, so splenomegaly. Not all sarcoidosis will be having splenomegaly. Okay, sarcoidosis, there is infiltration, but in different organs, and it will not be equally. According to the finding, you will know. Maybe in this scenario, due to discomfort, it was positive as splenomegaly. Anyway, if you feel there is splenomegaly, you have to examine the spleen. Okay, this is another point to be examined here, or another system to be examined in this scenario. Okay, thank you for the comments. We can start now, Dr. Minan, Dr. Saleh. Ready, Dr. Ina? Dr. Minan, ready?
Yes, sir. Yes, sir.
Okay, here you go.
Hello.
Hello?
I'm Dr. Akbar. I'm one of the doctors in the clinic today. May I confirm that you are Mr. Brian?
Yes.
Hello.
Yes. Yes,
53.
I'm
Can you
Mr.
hear me? 53
I'm
years
Mr.
old.
Who is
So I'm here
53?
to I'm here to discuss regarding your health condition. For that, I'll be taking your history and doing your examination. Is it fine with you?
Yes, it's okay.
Okay. Can you tell me that what has brought you in the clinic today?
I have I noticed that my tummy become more distended for the last 4 weeks, and I'm worried what is happened. What is
Okay.
going on?
Okay. So may I know that is it the first time you are having this problem or anything similar happened previously as well?
Yes, this is the first time.
Okay. And can you show me that where is the swelling?
All over my tummy, or
Okay. Do you feel any similar swelling in any other part of your body? On your face, on your legs, on your hands?
no.
Okay. Do you think that it started suddenly or gradually?
It's that during these 4 weeks it was gradually, then it become more.
Okay. And do you think that it's getting worse day by day?
I feel discomfort from this swelling. Even I found difficulty to sleep.
Okay. Do you have any tummy discomfort?
Yes.
Okay. What type of a pain is it? Is it dull, sharp, throbbing, band-like?
No pain, just discomfort.
Okay. And it's like where in the tummy? All over discomfort?
Yeah.
Okay. Does this pain or discomfort goes to your back or any other part of your body?
No.
Do you feel sick or throw up?
I feel I feel I'm sick. Even I noticed that I didn't have any desire to eat anything.
Okay. And this has happened for the similar period of time.
Before that, I feel um, my appetite not like before.
And for how long?
I'm not sure
Same period.
about it. Maybe more
Okay.
than that. But
Okay.
after that spelling, I feel more didn't want to eat like that.
Okay. Do you have any changes in your bowel works, like any loose bowel or color change, any blood,
No, no,
any problem in your water works, in amount, in color?
no,
Have you noticed any yellow skin or yellow eyes?
no,
Okay. Have you noticed any rise in body temperature?
no,
Okay. Are you being tired these days?
no.
Okay. What about your weight changes?
I feel I feel decrease in my weight. I feel that
How
now.
much? How much for how long?
Not sure.
Not sure. Is it like, okay. And you said your appetite reduced. So, any weather preferences?
I know.
Any lumps and bumps in any part of your body?
No.
Okay. Has anyone told you you are being pale these days?
Sorry?
Has anyone told you you are pale these days? Pale.
No, no.
Okay. And how's your diet?
It is the same, but I have no any wish to eat more.
Okay. Do you have any chest pain?
No,
Any difficulty in breathing?
no,
Any cough?
no,
Okay. Any joint pain?
no,
Any skin changes?
no,
Okay. Any skin rash in any part of your body?
no.
Any headaches?
That my legs, they are wasted, not like before, maybe of my weight loss, or I don't know.
Okay. I would like to see it, so please show me. Any vision problem? Any vision problem?
No,
Any numbness and tingling in any part of your body?
no,
Okay. Any abnormal shakiness in any part of your body?
no.
Okay. Is there any long-term illnesses you would like to tell me?
I have no other issue.
Okay.
No,
Any medications you have been taking?
no. Apart from some paracetamol for headache, if I have, but it is occasionally, not always.
Okay. Any history of hospitalization or surgeries? Hello?
No,
Any over-the-counter medications?
no,
Okay. I would like to ask you some personal questions. Is there any traveling history you would like to tell me?
no family history of any
No,
complaint.
no. Traveling.
No, no.
Okay. May I know that do you have a partner?
Yes, I have a family.
Okay. Sorry to ask you any casual partners?
Yes, I have wife.
Okay. Sorry to ask you any casual partners?
No,
Okay. Any contact with a sick person like tuberculosis?
no, I didn't remember like that.
Okay. May I know that do you smoke?
No, I didn't smoke.
What about alcohol?
Sometimes um, with some party like that.
Okay. So, okay. What, like in the social limits or binge?
Hmm?
Binge or social limit?
Sorry?
Binge or social limit? Like you binge or social limit?
Means
Binge in
Binge
the
drink.
weekends only.
Yeah, did you take it as a binge drinking?
Hello?
You mean a large amount of alcohol? No,
Yes, I'm
it
asking. Okay.
one glass,
Okay.
two glass.
Any contact with a sick person like tuberculosis?
No,
Okay. And may I know that what do you do for a living? How are the symptoms affecting your daily life?
I'm a musician. So just this my job regard. But nowadays I stop to make a party or like that because I feel discomfort and I feel tired. So I stop even participate.
Okay, all right. So we'll try to take help from social services if you require. Is it fine with you?
Yeah, it's okay.
Any needle piercing or tattooing?
No,
Okay, all right. I would like to examine the patient and like to see the general appearance and look of the patient.
it's okay.
So I would like to start my examination by seeing the hands of the patient for any nail changes, any clubbing, any colonychia, leukonychia, anemia, jaundice. I would like to check for the fine tremors and flapping tremors and for any
No,
palmar erythema and debutant contractures in the palm.
no abnormality.
Okay, I would like to know the blood pressure and temperature and pulses in this patient.
When 10/70 blood pressure, pulse 75 is regular. It's
Okay,
normal.
and I would like to check the eyes of the patient for any anemia, jaundice.
No pallor, no jaundice.
Okay, in the mouth, I would like to check for any dehydration, any anemia, jaundice.
No, apart from
Okay,
looking of wasted lower limb and some wasting of the body, no finding, and that tummy abdominal distension.
okay, okay. I will do the lymph node examination in the neck and the lymph node examination in the axilla. I would like to inspect the abdomen. Then I would like to palpate for any visceromegalies if I can. And then I would like to check for the ascites and fluid thrill, shifting dullness, and any bruise or inguinal lymph nodes and
It
the
is
gut sounds.
it is positive shifting dullness.
Okay, and the legs are wasted, as you said.
Yes, with mild leg.
Okay, so in the end, I would like to offer for the digital rectal examination and blood sugars and urine dip in this patient.
Yeah, blood sugar is normal and no need for rectal examination.
Okay, all right. So, what are your concerns, Mr. Vine?
Yeah, I'm worried. May I have a cancer?
Okay. Any other concerns?
No.
So, Mr. Brian, after taking your history and doing your examination, I have a few possibilities in my mind. It could be related, it could be cancers, could be one of the possibilities as well. And it could be something related with your, there's an organ in the tummy we called as liver. It could be related with that as well. And it could be related with some bug infections as well. We need to do some test in form of some blood test and some scans of your tummy as well, so that we will be sure about this.
It's okay. It's okay.
Okay. Any other concerns for me?
No. No.
Okay, so, okay.
Okay, anything else you want to ask or to examine? Still, you have 3 minutes. If you are done, we can start the examiner.
Sir,
The
I'm done.
questions? Okay. The
Yes.
question, Dr. Sally, please.
So, can you summarize for me this scenario?
So I have this 58 years old male with a history of gradual onset of abdominal swelling. for last 4 weeks, and it was gradual in onset, generalized, and getting worse. It is associated with some nausea. As well, there are constitutional symptoms of weight loss and loss of appetite with some tiredness, and also patient has given history for wasting of the legs, and he's a musician and there is no significant past medical history of note. And on examination, there is ascites positive with wasting of the legs.
Yes, okay. So, what is your differential?
So I would like to give differential for abdominal swelling. My case could be a case of ascites, which could be related with any malignant causes. It could be related with any infective causes as well, like HIV or tuberculosis. But other than that, I could not find any contact with the patient. It could be related with any malignancies as well. And it could be related with any protein malnutrition and enteropathies as well in the patient.
It's okay. So, how you will investigate this patient?
So I would like to go with investigations in form of complete blood count, liver function test in this patient, kidney function test in this patient. I would like to go for complete analysis of ascitic tap, cytology, DR, culture, gram stain in this patient as well. I would like to go for an alpha fetoprotein in this patient as well, and the SAG ratio in this patient as well. I would like to go for an CT abdomen if required in this patient. I would like to go for an hepatitis serology in this patient as well, and HIV serology as well, and routine urine examination in this patient as well.
It's okay.
And management will be in form of education, counseling, explanation, making a multidisciplinary team, which will
Do you need
include. Sorry.
do you need to admit this patient?
Yes, I would like to admit this patient.
It's okay. So, how you will manage?
So I would like to educate, counsel, and do the explanation to the patient. And I would like to make a multidisciplinary team, which will include a gastroenterologist and infectious disease doctor, specialized nurses. I would like to admit my patient, do the symptom management in this patient if required, diuresis in this patient if needed, and treat the patient accordingly with an underlying cause.
It's okay. Thank you.
Thank you.
Are you done with question, Dr. Sally?
Yes.
Okay, what are the differential again, Dr. Minam?
Sir, I would like to keep differential for ascites. Could be malignancies, underlying malignancies leading to the ascites in this patient. And I would like to keep infective causes like tuberculosis and HIV, but I could not find any contacts. It could be related with any protein malnutrition, but enteropathies. But against that, there was no history in the patient as well.
So you mean chronic liver disease?
Yeah, infections in the form of chronic liver disease.
What infection? Based on what?
Sir, I have kept infections, uh, but malignancies I'd like to keep the first for the ascites and in this patient or cirrhosis. Other infections could be HIV, hepatitis, alcohol, but infection contact seems to be less in this patient.
Yeah, but you have to have evidence. If
Yes,
hepatitis, what the cause of
there
hepatitis in
is.
this patient?
Sir, I could not find any history or any contact on the history.
Okay, so what could be also as a differential can make sense a part of the hepatitis infection from the history?
Sir, I would like to keep malignancies.
Okay, before malignancy, something in the history was positive related to the liver. or chronic liver disease?
Sir, alcohol was there, but he
Yes.
was not. Sir, it was not binge. He said that's 1 to 2 glass only. So I asked multiple times about binge drinking. So it was
Okay,
not there.
even if not, you will not put it. It's not
Then
exceeding the
alcohol.
limit. Yeah, so alcoholic and the other
Yeah, alcoholic.
non-alcoholic.
Autoimmune causes. Non-alcoholic
Non-alcohol.
or
Yes,
yeah,
yes.
non-alcoholic fatty liver disease could be.
Okay. Yeah, okay. So at least you have good differential related to the ascites and chronic liver disease. I don't know what the case, but let's see Dr. Sally what the case. She will comment, then I will comment.
This case pointed towards speaking about ascites of acute ascites. So they put the picture for underlying malignancy. So um, they put differential for possibility of other like obesity, but the scenario didn't go with the weight loss. And if she's female, for possibility of pregnancy or gases distension related. Um, so for the malignancy, they vote if she is female, possibility of ovarian cancer, or if male. And this scenario, it goes with other causes rather than ovarian cancer because she is male. So underlying malignancy not specified. They need to do investigation to know where exactly the cause. It didn't go with cirrhosis or liver related illness because it is acute ascites. So they exclude the cirrhosis and severe alcohol hepatitis, hepatic vein obstruction, heart failure, nephrotic, any other causes, tuberculosis, peritonitis. This one of the chronic cause of ascites, even carcinomatous disease, even it is hypothyroidism or pancreatitis. They all are in the list of chronic, the cause of chronic ascites. So it is a narrow differential for this scenario.
So what is the origin exactly? The cancer?
They didn't put, they concern mainly on the possibility of malignancy, but they didn't put basically
Patient?
where. Yeah.
Okay, so what about the concern? How to convince the patient that he has ascites, which is could be cancerous one?
So cancer one of the possibility. So we need first we need to do investigation. One of these is to do imaging called CT scan to know where exactly that origin of malignancy.
Okay, and over how long? The
What?
duration of this ascites?
4 weeks.
Yeah, the case was about duration of how much?
4 weeks.
4 weeks. I don't know. Is it okay to say cancers or ascites for the cancer origin for over 4 weeks only? Does that make sense? I'm not sure. Anyway, let's talk about the clinical part and the comment.
This is one of the rider I found. So
Yeah. I didn't say. I know some books are putting the cases like this for differential, but I don't think the nowadays. Maybe previously this is the old format of bases. They are doing this way. So to take history and give differential. It's okay also to know a differential and to do the case for differential diagnosis. But in new format, they are putting a case with a finding, positive finding, and I don't think this case can fit the new format because you have to examine. Here you are doing examination of the ascites, right? What other system I could examine?
I should look for. I think it should be there is
Liver, liver as
liver.
chronic liver disease. spider
That's
nevi
great.
and caput medusa. Or anyway, if you know, if female, I will accept the patient, or I will accept the scenario. I will say this is mixed syndrome related to ovarian cancer, and it can accumulate rapidly. But for female, I'm not sure. For male, sorry, I'm not sure if the male can have such cancer, which is associated with ascites rapidly accumulating. Anyway, let's talk about the approach itself from Dr. Mina. I think, yeah, the constitution symptoms here was positive, Dr. Minam, right? So the case
Yes, sir.
was, yeah, it's straightforward for a cancer or chronic serious infection. You sometimes you repeat the question like any contact with patient with tuberculosis. You repeated it again. I don't know why, because you want
Sir, there was
to confirm.
some voice
Yeah.
issue was there, so that is why I repeated.
Okay, okay, no problem. Otherwise, what do you think in the history you can put? Okay, I will add one of the differential which can be as acute accumulation of ascites. I think all of you know it.
I,
What
sir,
is
no, I can.
what is it?
Sir, we can keep Bachari as well.
Perfect. Yes, this is
But sir,
the target. Yes.
sir, yes, sir, it was in my mind. But sir, the thing was that I was trying to like
Yeah,
correlate
yeah, yeah.
any correlation. Are you
Yeah,
understanding
yes.
me?
Yeah, yeah, yeah. Sure, sure. Dr. Minam, I
Mm,
agree about the differential. Okay, and I
mm,
agree also with Dr. Sally. This is a book case, and they put it for differential. But let's discuss and think more. Okay, if you have acute ascites basis, what could be the case? As you said, acute Chiari syndrome. Bad Chiari syndrome. Okay,
mm.
how to analyze bad Chiari syndrome and to know the case? What you have to do, Dr. Mina?
Sir, on the basis of history,
Yes. What do you think you have
uh,
to do?
sir, I have to know about any hypercoagulability in the patient first. That,
Perfect.
like
Yes.
any family history of or the any clotting
Perfect.
history, any OCPs, smoking, any
Perfect.
radiations, any previous cancer. So I would like to
Okay.
correlate that.
Okay. So what are the questions in, for example, in the system review can give you a clue? Give me the condition, and the question will give you a clue related to this condition.
Sir, there is like for Bachari, like jaundice is necessary, but there was no
Okay.
yellowish discoloration or no
So you mean
generalized
the complaint? The complaint will be jaundice, and the manifestation will be ascites or diffuse ascites, along with tummy pain, abdominal pain. Okay. I'm asking about the hypercoagulable state, and you have to do screening during taking history, to teach others what I should ask during take history to confirm my differential or to confirm a differential and to rule
Mm,
out other.
mm.
What the question in the system review? What I mean?
For but
Yeah,
sir, for Bachari you're
no,
asking.
no, no, for hypercoagulable state or thrombophilia. So
Sir,
you said what? Yeah, only
any family history of
perfect.
clotting
This
problems?
okay. What the family history can conclude? If you ask about family history, what you can have a familial condition which is having hypercoagulable state. Give me three.
Sir, it could be like antithrombin 3 deficiency
Okay. What
and
else?
um, it could be other thrombophilias like
Like,
PNH.
yes, perfect. Paroxysmal nocturnal hemoglobinuria. What else? So, and the question of hemoglobinuria will be PNH. What the question for PNH?
Sir, like for the waterworks, are the color
Perfect.
change in the morning light in this way? Any other clotting problems? Any miscarriages? If a female is there, then
Okay, okay. Let's talk about one by one. So, PNH, I will ask about any change of the color of the urine early morning to dark, right? For the antithrombin 3, you will ask about family history. It will be positive family history of clot in the family. What else? Familiar.
sir, factor 5 deficiency could be there as well.
Perfect. Yeah, this is another
Yeah.
also. So
Yes, sir.
these part of family history. What
Hmm.
other parts in the history you can conclude another hypercoagulable state?
Sir, if the patient give any history of previous strokes, previous DVTs,
Okay,
any
so
leg
it will
swellings
be
or any so hospitalization, so it can give me a clue, any history like that for
okay. This is as a general blood clot, stroke, or
yeah.
heart attack. But what
Hmm.
are the disease? You didn't tell me. What are the conditions? One, you
Sir,
mentioned three of them: BNH,
yes, sir.
antithrombin 3, and factor 5 Leiden,
Hmm.
right?
Hmm.
What else in paces can cause hypercoagulable state? And you have to know.
Sir, I know it could be antiphospholipid syndrome in the female.
Perfect.
Could
Okay,
be
antiphospholipid.
SLE.
Oh, yeah, what is
SLE
the
can be
question? Okay, one by one. What the question of
okay.
antiphospholipid?
Sir, from a female, first I will ask for any miscarriages and
But
what
that's
was the
enough.
week?
Yeah,
What
that's
was the
enough.
week within 12
Okay.
weeks? Okay. Okay.
Okay, so I will ask about miscarriage. If there is positive miscarriage, I can conclude could be antiphospholipid syndrome, and I will confirm what trimester, right? Okay. What the next differential? So the antiphospholipid number 4. Number 5. What other coagulable state you know in
Sir,
basis?
lymphoma? Lymphoma.
Cancer, all cancers can be. Okay, so
Yes,
you will
sir.
know
Any
from the
cancer.
okay, any cancer can be. What else?
Yes, sir.
And the
And
cancer you will be having a clue from the constitutional symptoms.
yes,
One
sir.
one more, number 6.
Polycythemia rubra vera.
Perfect. How to do? From the history.
Sir, sir, I can start patient for any hot flushes from taking a
That's it.
bath. Okay,
Okay.
okay.
Perfect. So a hot flash after taking a bath. And itching, right? Some itching or you
Itching.
feel itchy. Okay. This is the number 7. Polycythemia vera. What else?
Okay. Sir, pregnancy itself can cause
Okay, yeah. So dehydration, pregnancy, all of them
and
can
so
lead to.
and so
Okay,
drugs like OCPs, one of the causes, OCPs. I
perfect.
would
So
like
in
to
the
give
history also, birth control pills. What else?
pills.
Number 8, 9. Two more
Sir,
condition, and
hormone.
I will
Sir,
finish.
in a menopause female hormone replacement therapy.
Okay, خلاص, we put it as
Okay.
birth control pills or as hormonal. What else? Two more condition you can put, and we will finish the 10 causes.
Sir, what about SLE?
We put it with antiphospholipid. What else?
Okay.
Yes, think more. You have two conditions, maybe more, but I remember two now, and we will discuss in the chat box. Someone will
Sir,
add.
smoking can be itself a cause.
Okay.
And sir, I would like to keep nephrotic syndrome as well.
Yes, this is number 9. I put in my mind. Nephrotic syndrome. The last is not only nephrotic syndrome. So in nephrotic syndrome, I mean any patient is losing protein. Okay, so you can minimally change or any glomerulitis with nephrotic syndrome, like membranous, right? What else?
Hmm.
The last, I
Sir,
added one more. I added one more.
uh,
So 11. Okay,
chemotherapies or radiation can
okay,
lead
as a
to.
cancer. Okay, as a cancer.
Okay.
Yeah, it's
Sir,
not
autoimmune condition, autoimmune
yeah,
diseases.
we put it as APLA, antiphospholipid and antibody syndrome. Someone add another condition now in the chat box. So we have 13 condition till now. But you have to say number 10 and I will continue the others. Number 10 is
Sir,
inf
infection.
inflammatory, inflammatory bowel, right?
It's also autoimmune.
Yes, yes,
IBD
inflammatory
is
bowel
also autoimmune.
disease. Okay. And I will add BASIT, right?
Basics. Okay, sir.
And someone wrote
Basics.
homocystinuria. Perfect. So let's talk about homocystinuria. You will have family history with mental retardation. Inflammatory bowels, of course, you have loose stool with diarrhea, bloody
Joint pain.
diarrhea. Yeah. Basic disease, you have the features of basic disease, orogenital ulcers and skin rash and arthritis, erythema nodosum. What else we mentioned? Nephrotic syndrome, you have frothy urine, significant frothy urine. Okay. Okay, so we are done with a lot of hypercoagulability. Let's go back to the sickle cell. Perfect, Dr. Nada. Sickle cell, one of the causes. Okay, so sickle cell also patient will have sickling everywhere, and it might lead to thrombosis. Homocystinuria, Dr. Antiphospholipid, we mentioned BIHST already, yes. PNH, SLE, antiphospholipid, perfect. Abortion, dark urine, clot, okay. Triad of abdominal pain, ascites, jaundice. History of risk of thrombosis formation. Please ask direct question. Any history of blood clot? Okay, you have to have history of blood clot. Maybe this is the first time, but maybe it has history before. Okay, but Chiari causes rapid accumulating ascites. Of course, I agree 100%. Acute liver failure, paracetamol toxicity, you can put. Heart failure can cause acute ascites. Okay, as right side heart failure. Yes, I agree. But the case will be more clear than this. So it's not as acute with possible malignancy, which is hidden. I think Ryder was a little bit vague in this scenario, but I believe it's one of the good books you can prepare. Okay, Dr. Sally, I'm not. I agree with the preparation. It's okay. Okay, not to be upset because of my comment. Any comment or question, Dr. Sally or Dr. Minam? We are done now with the ascites. I mean, as acute ascites, but Chiari
Sir,
syndrome. Yes, Dr. Minam.
sir, if you want to ask anything from me,
Sure. Me, I ask you?
if you have any questions for me.
No, no, no. I am done
Okay,
with the
sir.
comment and the question. You want to comment or you have any question?
No, no, sir. Thank you so
Oh,
much.
okay. Thank you thank you so much, Dr. Minam. Dr. Sally, you have any question?
No, thank you, and sorry for my preparation, but maybe all the
No, 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 at all, Dr. Sally. Don't feel like this. It's a study. We are see at least we learn and we repeated the causes of hypercoagulable state. I believe that any day and at any session we are learning, even repeated cases, even case is not with good differential or with wide differential. It's okay. Anyone are free and welcome to practice. We are learning. All of us will learn a point every day. This is the aim of this group and these sessions. Okay, so whatever your preparation, I agree. I never ask or restrict someone to prepare from a book or do your preparation, study your topic well. You will be refreshed. All of us will be refreshed. All of us will be learned. Okay, this is the aim of this group. Not nothing. So don't feel like this. Any preparation, I agree with. Okay. Anyone want to add any question else? Okay, thank you, Dr. Sally and Dr. Minam. Anyone want to comment? Dr. Nada, it is a case of differential. We take a benefit for yes, absolutely right. I will repeat one comment about the hypercalcemia or hypercalcemia, familiar hypercalcemic hypocalciuria. Yeah, I made the opposite. So I said hypocalciuria, hypocalcemia, hypercalciuria. It's always confusing. Anyway, yes, there is two condition, which is both of them are existing. So you have hypocalcemia, hypercalciuria, and the opposite, hypercalcemia, hypocalciuria. But which is common is FHH as mnemonic FHH, familial hypercalcemia, hypocalciuria. Okay, not to be confused like me because I always mix between hyper and hypo. Anyway, the case is the comment is familial hypercalcemia, hypocalciuria is the case of the hypercalcemia. Okay, the hypocalcemia is not common. This is what we realized and I make the opposite. Okay, thank you, Dr. Nada, for correction earlier. Someone also corrected with Dr. Nada. Anyone want to comment before ending the session? Okay, if clear for all, satisfied, we will end the session. Thank you, Dr. Minam and Dr. Sally again, everyone with the comment. See you tomorrow, inshallah, with the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.